Okay, I think we're going to hear House Bill 431 by Representative Jackson.
I've been waiting.
We've been waiting patiently.
9 o'clock. I thought
Okay.
Bagley would be gone.
Yeah, I did too.
He's been very diligent today. Oh Lord, and Turner's back, and everybody's back, and.
Thank you, Mr. Chair.
Okay, Ty, if you read that in, please.
Absolutely. Thank you, Mr. Chairman. This is House Bill 431. Provides relative to the hospice licensing law, to provide for the rules, regulations, and standards for licensing, to provide for the issuance of permits to non-licensed persons, to provide for the training of such persons, and to provide for related matters. Thank you.
Remember, I'm going to take a one-liner on this. This bill deals with the hospice care CNA program at the Angola facility. With that being said, I want to offer the amendments so that when I talk about this bill, I put it in its proper posture.
Okay, we'll hear from the amendments. Ms. Ty.
Thank you, Mr. Chairman. Members, this is amendment number 1220. It's a set of 12 amendments that have been posted and distributed in advance. Amendments number 8, 10, and 11 delete the words laboratory or. Amendments number 5, 7, and 9 delete the word department and inserts in lieu thereof Louisiana, Mississippi Hospice and Palliative Care Organization. Amendment numbers 3, 4, and 6 delete the words nursing care or other. Amendment number 1 inserts the rules and regulations shall require a hospice agency or hospice to disclose the employment of an otherwise qualified non-licensed person to its patients and their immediate family. Amendment number 2 deletes line 4 on page 2 and inserts rule adopted and promulgated by the department. The Louisiana, Mississippi Hospice and Palliative Care Organization shall develop and issue permits. And amendment number 12 deletes the word nursing and inserts caregiving. That concludes the amendments. Thank you.
Representative Jackson on your amendments.
Thank you. Members, these amendments do two things mainly. Number one, it takes out the department having to adopt and promulgate rules for this bill, and it changes to the Louisiana, Mississippi Hospice and Care Organization, and also it ensures that there is no reference to the nursing profession in it. That was an issue we looked at. That was probably drafted great. The bill is drafted great, but drafted at our request, and so that was one of our errors that we're taking out of the bill.
No questions on the amendment. Representative Jackson offers these amendments. Is there any objection to the amendments? Okay, they'll stand, so continue.
Thank you. Members, Angola offers the only hospice care program in the state. As you know, inmates from all over the state of Louisiana, when they require hospice care, pretty much are transported to Angola for hospice care. In this hospice care program, there are a few individuals that are inmates that are trained and certified as CNAs in hospice care only. What this bill says that for the few of them that get out, usually it affects 3 to 4 every 2 or 3 years. Right now, there's a current prohibition on obtaining a CNA license when you're convicted of a felony offense. This would remove that only for these narrowly tailored individuals that have practiced hospice care. Now, they will only have a CNA license as it relates to hospice care. They would have to inform their employer and anyone that they treat that they're under this special provision. But this is, this body overwhelmingly passed reentry on last year. We talk about reducing the recidivism rate, talking about those who have made mistakes being productive members of society when they come out. And this is one of the ways that we can do that, that if you have a skill set, and we do this all in a lot of other fields, it's just not a restriction where they're trained in welding. Individuals are trained in a lot of other fields and come out and they're gainfully employed. One of the most successful reentry programs is welding, from what I understand. We have a former inmate in East Louisiana that actually became a college professor in welding. that was trained in the reentry program in Angola, came out in welding, worked as a welder, now as a college professor, as far as welding is concerned. So we've seen a lot of success rates with this. Most importantly, when we've advocated for reentry and done what we needed to do, we've also seen a lower recidivism rate. And that's very important. I talk to people all the time about the cost savings, even if you don't see it on a bill, the cost saving and someone not, and this is not a CNA license, I'm sorry, it's only a permit, and it's only going to be for hospice care. But when we talk about cost savings, this is just one of those bills. You may not see it on the face of it, but when someone doesn't reoffend, number one, you have a cost savings. When someone is out and doesn't have to apply for Medicaid because they can't receive a job, that's a cost savings. When they don't have to apply for other benefits, it's a cost savings. It's a morality issue for me. I think once you have served your time, once you have paid your debts to society, you all have a chance to become a productive member of society. And you will see throughout this Capitol, I call it the blue shirts, always advocating for that and wanting to stand on their own 2 feet like you and I do every day and make a living and become a productive member. And this is just one of those bills that ensures it does that. It's a small movement because you don't have that many that actually come out and are even will qualify for this permit. But to the extent that we can help 1 or 2, we need to.
Okay, we have a couple of other people who want to speak. I think they're at the table. Jamie Boudreau and Scott Payton. Gentlemen, that's not you? I'm sorry.
No, it's not me.
Are they here? Do you want to speak?
I can go first.
Okay. Go ahead, identify yourself, please.
My name is Checo Yancey with our organization Vote. I'm going to let Jamie start out and then I'll kick in, see where it's coming from.
My name is Jamie Boudreau. I'm the Executive Director for the Louisiana-Mississippi Hospice and Palliative Care Organization. We're a nonprofit educational corporation that primarily does research, public professional education, public awareness and advocacy on behalf of hospice and palliative care in the state. 22 years ago, when I was hired by the board of directors, the first thing they told me was to go down to Angola because they were doing something that they were very suspicious of, and they were calling it hospice, and they were just worried that the integrity of hospice was somehow going to be compromised. So I made an appointment, went down to see what they were doing at Angola, and when I saw the care that was being provided there, I invited the board of directors to meet at Angola the following quarter, which they did, and they saw that the care that was being provided there was exceeding the care that we were actually providing at the community level. 18 years ago, we've been involved with this program since its inception, and 18 years ago, some of the inmate hospice volunteers asked if I were to ever be paroled from this place, is there a place for me in hospice? And so we started searching for that avenue to give them an opportunity to find a way into hospice. I think we found that avenue in terms of this legislation. There are about 80 programs, 80 hospice programs in correctional facilities across the country, and half of them use what's called the Angola model. It's become a model program for the country, and this is the beginning of that process.
I ate about half a bite.
Chico Yancey was one of the founders of the original Angola Hospice, and since in 22 years, I think there have been 6 hospice volunteers who have been paroled, who've won parole, Chico being one of them.
Chico, we'd love for you to speak, and we fill out a green card when you get a chance, please.
I thought I filled out one already.
Oh, okay, we'll try.
And I thought Ms. Liz turned it in.
Okay.
First of all, thank you all. I am a product of making a mistake over 36 years ago. Went to prison and never had a rule infraction in 20 years. I've been out now 16 years on parole, no problem whatsoever. But speaking of the hospice program, when I was in prison, they used to put a person, if he was dying, in a room by himself, in a cold room, and leave him there. Well, we would go over and try to help the guy because I was a prisoner myself. When Warden Kane came there, he thought about putting a hospice program. They handpicked trustees and people to sit with people and be trained. it was the most humblingest thing I ever done. I realized that I committed a crime years ago, but hospice humbles you when you're sitting with someone and they're dying. You had to be committed, you had to be strong, and you had to pray a lot. I've been out of prison now 16 years. I am not one of the people that's looking for a job in hospice, but we have guys that have gotten out of prison and maybe looking for those type of jobs. And today I would just like you to see the product of what can happen when you are rehabilitated and doing the right thing. I know they see me here as the blue shirts, and last year we passed, the prison reform and all these things. I am a product that shows you once you've been punished, you can be corrected, you can be rehabilitated, and now I'm sitting before you as a taxpaying citizen.
Very good. Thank you, sir. Is there someone else that wanted to speak? Yes, sir. Come forward.
Good afternoon.
Yes, sir.
Good afternoon. My name is Scott Payton. I'm the State Director for Right on Crime here in Louisiana. Many of you may know my predecessor, Ms. Elaine Ellerby. She left late last year and I took over her position. Prior to joining Right on Crime, I was with the State Probation and Parole Office in Ville Platte for almost a dozen years. I have worked personally with many individuals who have returned from prison or those who have a criminal background with their struggles in trying to find employment. We support House Bill 431 as it removes a barrier that was actually created by the state that prohibits these formerly incarcerated persons from doing the good work that Mr. Chancey spoke about in Angola. I had the opportunity to speak with a man that had recently paroled out. He served 20 years and he was in the hospice program, and he told me that while he was in prison, he wanted to make amends with his victim and the victim's family. But by law, he was prohibited from talking to those persons. So in his work with hospice, he was able to make reparations to that victim by working with those people that were dying. So he found some redemption and a way to give back by working with these individuals. So we're seeing in this program at Angola, where inmates are helping other inmates die with dignity, we're seeing that these inmates that are doing the helping are actually learning a great deal about how to live their lives. So there's a redemption portion to this hospice work. House Bill 431 gives the formerly incarcerated an opportunity to earn a living wage, support their families, continue to provide a compassionate service, and to hopefully break the vicious cycle of recidivism.
Thank you, sir. Representative LeBlanc, do you have a question?
Now, do y'all have any records to show the graduates from Angola, if they were working in the hospice, if they continued to do the same type of work after they got out?
They cannot do that work because they're prohibited.
Are you asking, are there any records of the hours they've worked while in Angola?
Right.
Yes.
There is documentation. I mean, everything is documented there. But what we're proposing is that in addition to the training that they've received as hospice volunteers, what we call caregiver volunteers, that they go through a 40-hour classroom, 40-hour clinical, plus pass the CNA license, the test. They would have to pass. They would have to complete all of that plus pass the test before we would give them a certificate from our organization, which in essence would be their permit to find work.
Okay, I really like this. That sounds like a win-win on it. At the proper time, I would like to move forward with the bill.
Okay, we'll take your motion. Representative Stagney, you have a question?
Thank you, Mr. Chairman. I like the intent of the bill. I have some problems with normally hospice care workers are licensed through who?
DHH, LDH.
Through the nursing board, right?
The professionals are
Yes.
They're licensed through the social work board, through the medical board, through the nursing board.
So tell me why you wouldn't go to those boards and have them license these individuals.
Well, we're hoping that at some point that they will come on board with this.
Is there a federal prohibition?
No, there's not.
No.
There's no federal prohibition. In fact, the Second Chance Act that was just passed by the Trump administration actually encourages employers to.
Because I was told there was a federal prohibition.
Not that I'm aware of.
If you were a convicted felon going back into this, the board would not issue a license
My
if they
understanding
were
is
qualified.
that's a state rule.
That's a state rule. It's not a federal.
So is it a rule by the nursing board, or is it in
I
statute?
think what happens is that the policy of the nursing board is that they won't place anyone with a conviction on the registry for work currently.
And that's a
think
nursing
that's a
board
policy.
decision. I don't think it's a state statute.
Right.
With the Second Chance Act, of course, there's no prohibition against it.
Yeah, because look, that's where they should be licensed. I mean, we're going through an alternative permitting process. I like the intent. As you know, I voted for all of justice investment.
Reinvestment, yes.
And so that it creates a bridge to gainful employment, but it doesn't make sense to me that we have to go through the exercise of this kind of bill because the nursing board or any board will not come to grips with what's happening in society today, where we are trying to get everybody gainful employment if they've changed their ways. So let me ask you this:
There
how
was
many
someone
other?
from the board of nursing that was here before the recess that was going to address this,
But they had to leave.
but they had to leave. In our conversation, we're willing to work with the board of nursing to bring them on board because, like you, I really want them to be licensed.
And
I
if
don't
at some
want. I don't
point-
want them to have skim milk. I want them to have the full.
Yeah, and listen, at some point, if the nursing board comes on board at any point, then I would amend this bill throughout the process. But the truth is that those who have this training, who have very little training in other areas, who are trying to become gainfully employed and become, productive members of society, I can't, and I have not spoke personally to the nursing board, but I felt like at this point we do it by whatever avenue is possible to get them to the point where they can be employed, right? And so at any point throughout this process or any year that I'm elected that the nursing board wants to come on board, I don't think anyone would have an objection to them being fully licensed. I mean, that's
No, and it
what you
needs to
wanna
be
do.
done that way eventually because you're going down a slippery slope that you're going to carve out special, different permitting processes for different groups of people among different professions, and you're going to dilute what boards are supposed to be doing. And so I'm not knocking you. What you're doing is a good deed. But I'm saying that some of the boards are going to have to come into compliance of what we're all trying to do and give people a second
the
chance.
Justice Reinvestment Act, and I agree with
in
you on
life.
that. And I have not spoken personally to the nursing board, but I give you my commitment that throughout this process, from now to the floor, I will sit down and speak to them personally and see if there are any issues and why they're not on board. Liz has, and I see she's coming to the table.
Hi, Representative Stagney, Liz
Yes.
Mang. I'm representing Smart on Crime and the Pelican Institute. Representative Rick Edmonds has a Second Chance Act that is very similar to what was passed on the federal level. It will be heard in Commerce in the coming days, so you might want to take a look at that. Maybe an opportunity.
And
to
it
do
addresses
something.
these concerns that I'm raising?
Yes.
Sure does.
Okay.
Okay.
Okay. Let me ask one other question. How many other employees does the Louisiana Mississippi Hospice and Palliative Care Organization permit, or it doesn't say license, it says permit? Do you?
We don't do anything. This would be our first. We are a nonprofit educational corporation. We just support hospices. We provide conferences and workshops and things that will support. We are a provider of continuing education for all of those professionals who work inside of hospice, and we've been doing a lot of work inside of corrections, like I said, for the past 22 years, supporting what Warden Kane started over there and providing them with the technical expertise to get the program where it is today.
Thank you. Thank you, Mr. Chairman.
Thank you, sir. Representative Moore.
Yes. Representative Jackson, I just want to commend you and the others about this. Before becoming a representative, I was a police juror for 11 years, and I pushed for reducing the recidivism. And with my leadership just recently, along working with the DA, law enforcement, and all, the others. We are building a $500,000 facility, which should be groundbreaking coming up this month. And one of the pieces is, of course, what you're trying to do, give those that are in the facility right now an opportunity to get the job skills that they need, that when they exit out, they will have an opportunity. So reducing recidivism has always been a concern of mine. And once they're out, they can get a job and so forth. But I'm also looking at other opportunities that will help them and help the parish reduce the recidivism. So I commend you all on this work.
And thank you, Representative Moore. I plan to be at that groundbreaking. You worked it really hard in our parish because funding was limited. But I join you in your concern at all times to make sure that we are giving people an actual second chance. I tell people all the time that if it was just a department, it'd be one thing, but we call it the Department of Corrections for a reason. If we can't correct and rehabilitate, then we're not in the right business.
Thank you, ma'am. Okay, I have some other cards. You just heard from Liz Mangum. These are all cards that are in favor, not necessarily wishing to speak. Also, Elizabeth Harper, the Alliance for Hospice, Renee Amar from Pelican Institute, Christian Rhodes with the Justice Action Network, Jessica Fresnel, Ann Steyer, the National Association of Social Workers, and Cormencia Hill, I think it was CPA. Representative Jackson, you want to close? We have the motion by Representative LaBaugh. You can use that as your close.
Yeah, I was going to give Representative Turner my close. I don't think he was able to file any bills, but I waive.
No, I think that he did. We have a motion, Representative LaBaugh, to approve House Bill 431 with amendments. Is there any objection? Without objection, stand approved. Good job.
Thank you so much. Members, co-author sheet if you want to co-author. Be passed around. I'm requested of the staff.
Okay. I think we're down to about 3 bills, guys.